Get ready, folks.
I sure am. Are you ready?
I sure am.
Super excited. Good afternoon. This is Dr. Rebecca Foster. This is Paranormal PhD on Paranormal Reality TV, and it is May 24th. Big old shout out to my bestie, Carrie. She is 50 years old today. Whoop, whoop. Happy birthday. If you're watching, I got an itch. Excuse me. It's one of those days, you know, allergies high. I don't know. I don't even know what to tell you. And how come is it that the wind picks up during the day and at night you lay there like dying on your bed? And it's that point too where you're between the hot and the cold, and I will push it as long as I have to before I turn on the air conditioning, because this is like the save your money weeks where you don't have to breathe the inside air constantly. You can have the windows open, and I love that. So thank you for joining me, and I am going to be doing medically intuitive readings for probably the next 45 minutes. Only reason is because it is the end of the school year, and my son has a wax museum thing that he's doing at school that I have to make it to. I'm sure you understand. And I am always I'm always told like the day of, like, hey mom, I need this, or hey mom, don't forget this. So I have to scoot a little bit earlier today, but I'm always going to be back, right? Knock on wood. God lets me. All right. So I'm going to be doing some medically intuitive readings for you guys right from the chat room. And this whole thing, me being here on a beautiful day like this today or last night, is basically to bring some attention to this show, Paranormal Reality TV, and to gain the support of our viewers. And your support makes it possible because it helps to support the show itself and to help make sure that we are not only, we have fan base to even do it for, because what's the point of doing it if you don't have people watching it, right? But also because it helps to facilitate the financial movement forward as well, because this stuff is expensive. It's like the most expensive thing that I've ever done. So yeah. Or other than school, no, school takes the cake at this point. All right. Good morning or good afternoon, Michael. Hello. How are you? Heather, hello. CG Beauty, hello. Yes, happy birthday, Carrie. What? Hello, Kelsey. Tattooed Sweetie, hello. And yeah, I'm telling you, right across the street is a field. And I swear that it comes in waves where I'm good, and then I'll have a week of a headache due to my sinuses. Hello, Tally, how are you? Tracy, Isabel, yes, and then Lori, hello. All right. Can't handle the damp chest. You know what? I don't like it when it's humid out and everything you touch is wet or feels damp. I don't like that either. And that's the good thing about Heather, I'm sorry, saw Heather pop in, air conditioning. That's the good thing about air conditioning. It just pulls that dampness out of everything, but I am putting it off, man. I love the smell of outside, inside. Hello, Jamie. How are you? Hi, Lala. All right. Yes. Well, I appreciate it's fun watching it grow. I understand that too. You know, there's not a day that goes by that I am not manifesting as much as possible and praying about it. And, you know, you have to think about it and picture it and see it and then just let it go. Go to the universe. Okay. So, Michael, you're asking if let's see here. So, wondering if I could see it causing your left knee pain in your right, causing left knee pain in your right leg. Okay. Causing left knee pain from your right leg. Well, let's just look and see what's causing the left knee pain. All right. So Stretching out my legs. Left knee pain. That's interesting. All right, let me back up. Feel the whole body here. I swear that feels like, and I'm sure you've had physicians look at this. I'm looking at the veins, I'm looking at the ligaments, I'm looking at everything. And as I'm bending my knee, it's popping. So as it's popping, it feels like the pop is coming off of the top of my kneecap. And I don't know, I just went blank. I do know it and I can't think of it now because I'm not using my brain. But somebody here can answer it. It feels like it is, I don't know if I'd call it a muscle. It feels like a ligament or something. I'm wondering if it's the way that it pops like that off of the top. I can't feel it anywhere else except the top of my knee. And it feels almost like something is, if you had a piece of fabric and it ripped, it feels like it's like that. It's like catching every time I move my knee on this ligament, or it would be like that flat and it's catching it every time I move my knee. So I'm assuming that you've had people look at, I'm assuming people, okay, I see what you're saying because you said your left knee pain and it's in your right. That's why I was like, I'm confused. I'm wondering if it is this, the ligament or whatever that is, I can't even think, that attaches to the top of the knee. I know something runs through or over it, and being that I'm not a bone doctor in any kind, way, shape, or form, all I can do is picture it and see what they're showing me. And it's almost like you've got something catching as you're bending your knee, because it doesn't feel like it's under or in. It feels like it's on top of the leg, on top of the knee. I would have them maybe a bone spur. Maybe a bone spur. I would have them do an ultrasound if they haven't done it already. I would have them do Doppler or some kind of ultrasound on the top of the kneecap, where the meaty part goes to the top of the bone. It just feels like something is catching, because I can't feel it anywhere else through. Okay, and so you've had physical therapy on your knee, but I would ask them if it's still causing pain. I would have them go in and double check to see what's catching. What is it in there that when you're moving your knee gives me the heebie-jeebies? Catching. So that's what I would do. And Jamie mentions a bone spur, which is very possible, but it's at the top of the knee. And it's not soft tissue. It's not the muscle. So there's that. I would get it checked out. Hello, Heather. How are you guys? CG Beauty, really quickly passing over you. Maybe, I don't know why, my eyes started hurting as I got to you. So maybe going in for an eye check, getting your eyes checked. Maybe your script is off. Maybe with all of the focus on that we're doing this, constantly staring at screens and blue light, maybe there's a little bit more eye strain there. I think generally noting that at the age of 40, our eyesight starts to go down. So if any of you are over 40 and have great eyesight still, props to you. But if not, it just feels like eye strain. And I can feel it even just focusing on you right now, like my eyes are beginning to hurt a little bit more. So maybe you're in for a new script. If you've been getting headaches or headaches across the head here, I would put money on it being a new script is needed. Okay. Kelsey, hello. All right. Heathers are good too. There are a lot of Heathers following. You're right. Very much so. All right. And yes, the The wind does make it better. Exactly. Hey, Casey, how are you? Let's do, you know what? You were in last night and I mentioned you and then I didn't even read for you. I haven't talked to you in forever. So let's vibe on you, girl. Let's see what you've got going on. All right. So these are all health readings today. So maybe I don't pick up anything on you. Maybe you are perfectly healthy. But let's look. All right. Good. Good, good, good. Good. So I do pick up pressure or stress across the chest. Usually that would be noted as like anxiety or worry, stress, worry, because we're talking about physical, mental, and spiritual health here. So meditation, relaxation, breathing exercises are great. Bringing blood pressure down, relaxing the body, and letting go, kind of like just letting go of things. Um, Overall, the stomach is okay. Everything else looks okay. I don't pick up anything else on you, but needing to breathe, needing to just relax, needing to just let go. That feels like it would, and practicing that all the time, being mental about it, setting a timer on your phone or one of those little notifiers that says, hey, time to close your eyes and count to 60 backwards or something. Isn't that what they taught us on Sesame Street? Or was that, what was that? Who did that? Was that like The Simpsons? I don't remember. All I remember is somebody going, no, that was Fred Flintstone. That was Fred Flintstone. He used to count backwards when he'd get really, really ticked off. He'd be like 10, 9, 8. And then he'd get to about 3 and scream, Barney. Mama. Yeah. So I just aged myself, but I don't care. I really don't care. All right. So what did you say? You have pink eye a week ago and every morning since you woke up with blurry vision. You know, pink eye, if it's what it is, if you're still healing from that, that's one thing. But I'm wondering if it's just also the need for a new script. So it's nothing wrong with going getting your eyes checked, like the prescription in your lenses, making sure that it is right. Because just the slightest off can cause eye strain. It's stupid. It's dumb. Yeah, it's just dumb. I hate it. I used to have like eagle vision. I could put the tiniest print this close to my eyes and I could read it. I could read it further away. I could, ugh. And then all of a sudden, nope, it just stopped. C'est la vie. All right. You're welcome. You're welcome. Namaste, Zaki. Peaceful there too. Very peaceful. So, Zaki, anything for you? No. Eating regular. Make sure you don't forget to eat. That's what that felt like. It felt like I was forgetting to eat or something. Like my stomach was really empty. And then when I eat, my stomach is like, oh, stop feeding me. So there's maybe this relationship with food that you're hungry, but you don't eat. And so that something is off. You're talking to a person, that eats like 7 times a day. I eat all of my meals plus snacks in between. So make sure you're eating regularly and you are moderating all of your food, making sure that you're eating something from every group. I don't want to say from every group because a lot of times dairy just isn't good for you anyway, especially as we become adults, but making sure you're eating the right kind of dairy, maybe some Greek yogurt or minute amounts of cheeses. Drinking milk though, like literally, I don't think there's any good reason to drink milk as an adult. I just don't think so. I don't believe so. You want your calcium? Find it another way. I literally see more problems with adults who eat a lot of dairy and drink a lot of milk than I see it being like, hey, get in the dairy counter and start drinking that. I don't think I've ever told anybody to do that. All right. Kelsey, you're having pain in your back and you don't know why. Interesting, because I was going to say, like, I don't know which one of you all here is having a backache, but man, my back started hurting so bad I thought it was going to spaz out on me. So, and you don't know why you have the back pain. Ugh. All right. So, Kelsey, are you? I'm trying to move down the back. It feels like it is. If these are the tops of the hips, okay, it feels like it's maybe 3 inches above the tops of your hips. It does not feel like it's kidney area. It feels like it is almost middle of the back, above the hips. And it feels like you may have simply twisted or moved the wrong way. The problem is this: do not bend over and twist. Don't ever do that, especially at anybody's age that I guarantee is in this room right now, because the rest of them are in school. Do not bend over and twist. Bending and twisting at the same time will surely pinch something or throw it off. You bend over and pick it up, and then you move over, and then you bend over and pick it up there. You don't twist once you're bent over. You're screwed if you do that. You will pinch something. Yeah, mid back. So, right, mid back, below the kidneys, above the hips. It just feels like that's what's happening here. Boop, you pinched, you twisted and pinched, you pulled something or you pinched something right there and it could be just as simple as sitting in your car and twisting to reach in the back. Screw it, you're done. You're going to pinch something. Don't do that. If you need something, you get out of the car, you keep your back aligned, and then you bend over straight and get it. As adults, the trick is not bending and twisting, because we have used up cartilage within our bodies to help keep our balance, homeostatic balance. And so we don't have the ability all the time to protect those nerves from slipping right in where it doesn't belong. And it will find its way right in. It's like perfect dropping a penny through, or money or a phone through a vent or something. Seriously. So be careful. Okay, so Zachy, you can fast forever. And that is what they're probably telling you. If you're able to fast, what they were saying is you were eating and then you would eat and then your stomach was like, oh, stop eating, Zachy, stop eating the food, you're killing me, that kind of thing. Make sure you're trying to get something throughout the day. And just a little bit even. You don't have to stuff yourself. I wouldn't think, but maybe a little piece, like pieces of fruit, fresh fruit. But if I were you, Zachy, I wouldn't go munching down on some super crisp, like honey crisp apple. I would skin it first, especially during the day when your body is used to, especially when it's used to fasting. Don't ask your body to break down a bunch of fresh green vegetables either. No, you will not be happy in that either. No. All right. So Kelsey, the pain has been since February and you go to the chiro regularly. Okay. Well, depending on what your chiro is doing every time, maybe it's time that they get another scan or another x-ray or something. And maybe give it a break too. I mean, you can't have too much of a good thing. And if you're going in there weekly and they're popping that and banging it around, maybe your body just needs to function and do itself. It's like, why do women need all of the, why, if your body is doing its natural thing all the time, like immune systems, cleansing itself, why do you need all the other things out there that, I don't know. So if you're in pain, and you've been seeing the chiro lately, I would give it a little break. I would just give it a little break. Maybe get on yourself, get some kind of anti-inflammatory and see if that helps. And if not, then go back and start off fresh with a new scan and see where it goes from there. But I'm telling you, it feels like you pinched a nerve in the middle of your back. Like you have a frayed nerve. I'm so afraid. That's what your nerve is saying right now. Stop popping me. Seriously. It's the only way I can put it. So you've had the x-rays, ultrasounds, and CT scans. Then give it a break. Completely give it a break. Don't keep going weekly if that's the problem. If what you're doing is not working, regardless of if it's supposed to be good or bad, stop doing it and then give it a break. And if it starts to heal, then you know what the problem is. But chiropractors are great when your body is misaligned or when you are dealing with something that is problematic or painful. But if you are doing something regularly and it's not working, you stop. You just stop. You stop doing it. You change it. So, Jamie, what did you say? You're over 50. You bend with your knees. With your hip? Like, yeah, exactly. Yeah. Bend your knees, lift, exactly. And you use your butt and your legs to lift as well. Don't ever just use your back. It's a bad deal. Bad deal. Tracy, you had your 4th back surgery. Your back is usually good for many. Your back is usually good. Yeah. And are you having troubles now? Or are you saying that it's been, oh, okay. You're welcome. I know people too, they get those little electrodes put in there that help to short out the nerves so you don't feel the pain, which is great. My mother has one. It's great if you're in severe pain all of the time. However, it's still not treating the main cause of the pain. So you're walking around like, I don't feel anything. And at the same time, the like nerve is completely separating and you wouldn't know it because you're not in any pain. So if you get the help for something, still continue to find out what's causing it, what's causing the problem. Because again, you have to fix what's causing the problem before that. Yeah, no, Kelsey, I would bet money on it being a pinched nerve. I would put money on it. And I would stop seeing the chiro for a while and go on an NSAID. Yeah, non-steroidal anti-inflammatory drug. That's what that is. And so there's that. So Tracy, now you are having the troubles. Okay. And you know what? I know for a fact that when it comes to back surgery, they say that it is just like knees and hips. We use these all the time. I mean, these bodies have been in effect for a long time, and that's why we really have to take care of them. But I'm not surprised because they do say that you can go in and get surgery, but there is a chance that you're going to experience the pain again. And that's where it becomes like, wow, what do I do? Do I get the surgery now and then have to do it again? Is this a repetitive thing? And the sad part is that you're dealing with things that wear down, nerves and cartilage. Anybody that's dealing with problems like that, you can also help the situation by going gluten-free and by making sure, again, you're bending right, you're taking care of the nerves, you're taking vitamins and supplements that help maintain the nerves. You're taking a joint and a chondroitin and a glucosamine supplement to help build those up, and then go off of gluten because gluten is bad for your joints. If you have arthritis, go off of gluten. Gluten creates, American gluten, let me correct that. It creates inflammation in the body because it's bad for us. It's just not good. And gluten is in everything. I mean, it's scary what's in everything that we take in. But for the most part, if you go off of gluten, you will notice an improvement in your joint health. And that's just a fact. Okay. Turmeric, curcumin for information. Yeah, exactly. The turmeric is fabulous for it. And you don't even have, some people don't like it, but in order to make turmeric really, like you have the turmeric curcumin, if you just have turmeric, you need to add black pepper to it. That is the curcumin. So for instance, if you're going to make a smoothie, and you want to throw some turmeric in there, that's great. But you also have to add black pepper. You have to have the combination, or else the body does not absorb the turmeric. It needs the black pepper. So make sure that that's the case. And if not, just get the combination of the two. Okay. All right. Terry, what did you say here? Quick scan. My mom, she's sitting in the room next to you. Or she's sitting in the next room. Okay. Yep. So let's see here. So Terry, interestingly enough, with your mom in the next room, it almost feels like dementia. I feel, as I'm not only looking at her, but as I am sitting there, I'm wondering if there's some kind of cognitive thing happening here. And I don't know if it's an early onset or if it's something that's starting, but I feel cognitively that I'm sitting there going, what was I going to do? What? Oh, yeah. Oh, and I'm almost feeling not like myself in the fact that I'm not able to pull out my thoughts, and I'm realizing this as I'm sitting there. I'm like, where did they go? Oh, did they? So I'm also talking to people. I'm hearing people as well, which means if there's in form of dementia or any kind of just what the heck is it called? I just went blank. Let's just call it dementia. That veil also drops a little bit because they lose the full connection to who they were in this lifetime. And all of a sudden they're like, oh, there's grandma and grandpa and the chickens. And, oh, they're able to see so many things. So you think they're just like talking in the wind, and they're not. They are communicating with people that are checking on them as well from the other side, which is a beautiful thing. So we see them as suffering, and they just come out of their shells uninhibited and seeing people. But that's what I'm seeing there. And I'm supposed to tell you the loving the smell, like fresh flowers, a fresh bouquet, loving, I don't know if those are lilies or orchids, but loving those. So that's very cool. Oh my gosh, Joanna, I am not well rested. I feel completely exhausted. So Jamie, you have muscle spasms in your legs at night. Interesting. Okay. Yeah, and bananas will help with that too. If you need potassium, if you have low potassium and magnesium, you'll have the leg jitters. So bananas and dark chocolate covered bananas. 1 a day keeps the doctor away. Dark chocolate covered bananas, and that may help with leg spasms at night. All right. Love that. Debbie, you had a pituitary brain tumor surgically removed, but still suffer from severe brain fog and joint pain. My doctors aren't helpful. I feel like hormonal issues. Any thoughts are okay. So, Debbie, let's see. Let's go to your head. Okay. Actually, you had a tumor removed. So I can see, it feels like, I know if I do this with this, I don't know if the camera will pick it up. It might. So if this is your brain, okay, and this is the pituitary gland. Okay, so this is your brain, and this is the pituitary gland. Right up in this section here, almost right above it, it feels like a void. I'm wondering if this is where the tumor came from, but this feels like a space. And with that, it feels like something else is enlarged. I'm wondering if there's an enlarged hypothalamus or amygdala. I'm wondering if something is enlarged. Now, my next question is to you: how short-tempered are you lately? Are you short-tempered? Do you get angered quickly, or do you find yourself jumping the gun? Because if that's the case, then it's probably an enlarged amygdala. And I don't know what that all entails, but I would ask my physician if, because of the removal of that tumor, did it alter the growth of the amygdala? Did it allow any hormonal changes in that? Because the amygdala, that is our reptilian brain, so to speak. And normally with brain function, we're able to cognitively pull our thoughts to the frontal lobe and really think about things instead of reacting to it, which the amygdala causes, we respond to it. So when we breathe, I'm not going to beat the heck out of this person. I'm going to think about what I'm going to say and do. Boop, you're pulling it to the front going, okay, let's talk about this as adults. That's what the conversation is between those. So my question is what kind of feelings do you have all the time? And do you feel like maybe you're out of sorts and you're having heavy anxiety? Okay, perfect. So that's what you're saying. Yes. All right. So I'm wondering if you can ask your physician if there is any way that they could just check that and see if there is a way to hormonally correct what's happening to your inner brain, amygdala, hypothalamus. I would even think maybe that you're having things that mimic like menopause and stuff that would be like hot flashes, fuzzy thinking, loss of short-term memory. So it might also be because that plays hormonally with a restriction of hormones with the pituitary gland. I'm wondering if that was slightly damaged. And with what I'm picking up, it almost feels like phew, somehow hormones are wiped out. Like you have zilch to none, and it would have happened quickly. So I would find out about that. Of maybe a hormone replacement if they feel it's safe enough to do after having a brain tumor. Those are the questions you want to ask. Is it safe to go on hormone replacement to level myself out, or is it detrimental to possible regrowth of this tumor? And then question the amygdala and find out how all of this would have adversely affected how it functions. Because I am definitely not a brain surgeon. I could be, maybe. Just give me a scalpel and I'll try it on a dead person already. See if I can really hit it, right? Yeah, that's totally understandable, Debbie. When you are when your hormones are out of whack and you're nervous and scared, that compilation right there and that combination of things can make you feel like you're losing your mind. Find some good meditations to help calm you down and debrief yourself every day, and realize you're not dying. You are not going to die, but you are dealing with and feeling the physical properties of things that have gone wrong, and it feels like they're correctable. It feels like this is something that can be corrected. Yeah. Yeah. Man, it is warm. It's like super warm out right now. I feel like I put like a pepper lotion on all over me. I'm like burning up. Has my water even got anything in? Let me see. I do have some water. Okay. It's water, I swear. Okay. I love water. I drink so much water. You don't want to drink too much water because too much water is also a very bad thing. You can totally wash away all of your electrolytes and that will screw you over and you get palpitations and everything. Yes, really bad deal. Yeah, I think it's like 85 here today, Michael. Debbie, you're welcome. Okay, I will take the heat. I will take the heat all day as long as I'm dressed for it. And right now, I'm in long sleeves and I am not dressed for it. But it's because I have to go to the school. What time is it, as a matter of fact? Okay, I have like 6 minutes. All right. Whew. Heather, you're diagnosed with anemia. So it's not in the bones. It's not in. It looks. It doesn't look like it's in your bones. It doesn't look like it's in the marrow aspect. I'm looking at, would iron help? Probably, but I'm looking at also the redness of the red blood cells. Like I want to see red. I want to see red blood cells. I don't want to see burgundy. So right there, that tells me oxygen exchange is one definite thing happening there, and a good iron supplement. And I'm not talking like constipation level iron supplement. I'm talking a Flintstones vitamin. Okay. Everybody in here should be chewing a Flintstones vitamin because of the iron content. Most vitamins have too much crap in them that you don't need, and you usually just get from your vegetables and fruits if you're eating those every day. But a good 18 milligrams or micrograms or whatever it is that's in a Flintstone vitamin, that's a good amount for most people. But I'm seeing the oxygen levels need to go up. So what I suggest that you do, because I'm looking for any kind of like hypolysis, I'm looking for any hypolysis, I'm looking for hemolysis. I'm sorry, not hypolysis. That's the liver. Hemolysis. I'm looking for any breakage in the cells. I don't see any cells exploding. I don't see it. They come out of the bones just fine. I'm looking for any leakage anywhere in your body, and I don't see that. But I do suggest that, let me go back to what they were telling me. I would suggest that you, okay, so you need to increase, get on very short term, maybe for a week, get on guaifenesin, get a mucus relief pill. It feels almost like you are just so used to having mucus in your lungs, film in your lungs, possibly from post-smoker or from being in a bar or being around. It's like you've just grown accustomed to living with this. And I bet if you start taking a mucus relief pill with a guaifenesin pill, 200 to 400 milligrams a day with your water, you will probably start coughing things up you didn't even know were there. I would also go on a bit of a liver cleanse too. Speaking of your liver, do a maximum of 2 weeks, milk thistle and dandelion with a lot of water. So do those two things and see how they make you feel. And maximum, I would just do a week on the guaifenesin and 2 weeks maximum on the dandelion and milk thistle. You can get those pills at a Walgreens or Walmart, whatever. 2 weeks, that's it. And see how that helps with that. Mm-hmm. That's funny. That's funny. All right. It is getting too hot. Imagine Media. Hello, Jamie. How are you? So Michael, when I was saying last night, when I did the reading for you last night, I'd said that you had been, you didn't win the drawing last night. I believe that was Mary Flores that won the drawing. So if anybody wants to get a reading, you can go to godstool.com and book there. But yeah, last night you didn't read, Michael. I just said, oh, maybe I shouldn't read you because you have your names. I didn't want to read you and then draw you, but then I read you. So you can actually go back and watch that. And you can see the reading that I gave you on the thing last night. Okay. All right. Marjorie, you're taking iron. Oh, so Heather, you're taking iron pills. Yeah. So I would do like a bit of a cleanse. You're on the iron pills. If you're on them already and that's not working, then I would try a cleanse as well. And the guaifenesin for sure to increase your oxygen output for sure. And you're welcome. So Marjorie Stevens, anything with you, with your gut, high blood pressure, and brain fog? yeah, it definitely looks, that's definitely hormonal. This looks like you have a combination of things all happening, which makes it very difficult to define. And don't Google these things because you'll be dying of some thing from Mars. So what I really watch your alcohol intake, because alcohol will exacerbate any kind of menopausal symptoms or any hormonal symptoms. If you're having hot flashes of any kind or anything like that, you drink alcohol, you just be sweating all day long. So watch your alcohol intake. You have to separate the two. So I would also suggest that you get on a good prebiotic and probiotic. Now, I will tell you this before I go, because I know I have to go, but I'm going to tell you what you want to get, ingredients that you really want to get. And I have to search this really quickly because I want to tell you what it is, like a lactobacillus for H. pylori. And so I'm going to tell you right now that you want to look for, and I want to make sure I'm telling you that correctly. Okay, yeah. So it's for the H. pylori. That is probably what I'm picking up. You have an imbalanced thing happening in your gut. So you want to get one. There is one actually. I can't give you a picture of it right now on the screen, but you want to find one that has the L-reuteri. It's L-R-E-U-T-E-R-I, L-reuteri, Lactobacillus reuteri, and it helps with H. pylori, and it will balance your belly out. But it's L-reuteri, Lactobacillus reuteri. It's R-E-U-T-E-R-I, reuteri, Lactobacillus. Oh, look at that. It did it for all of my pages. Boop, boop. Okay. And they're difficult to find, but you can find them on Amazon. And I don't think you will find them. You will not find it in a Walmart or Walgreens. You're going to have to go online and find it, or a health food store, or a chiropractic's office, something like that. L-reuteri for the H. pylori, and that feels like it will help with all of the things that you've got going on. It's amazing how many things can go wrong if our gut health is imbalanced. It's horrible. So again, I hate to cut you guys short today, but I do have to go to this wax museum thing where they're like wax people and they put on a whole show, and then they're like, "Hi, I am blah 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 blah," and you get a whole educational lesson on major figures throughout history. So I will see you guys again, if not before next Tuesday. I will be back Tuesday at 7 Eastern, at which point I will be drawing more names for people who on the Paranormal Reality TV page on Facebook share the posts between today and next Tuesday. So I will talk to you guys. Thanks again for joining me. Have a great day, and see you later. Oh, bye. Bye.